Hi everyone and welcome to another episode of ParentTown TV. Today we have Sister Kang from Mount Alvernia Hospital with us, and we're going to be talking about something that's very intimate for me, breastfeeding, and how to have a happy breastfeeding journey. So Sister Kang, how did you get involved in lactation consulting work and just in the whole breastfeeding journey?
Oh yes, and I started working in Mount Alvernia in 1980. Then at that time a lot of mothers actually mixed feeding. Then until about 1990, we have a new director who came from Australia, and she said, "How come so many mothers bottle feeding? We should be encouraging breastfeeding." And said, "Oh, we should open a parent craft department in our hospital to help breastfeeding mother."
So this is in the
yeah,
1990s?
That's 1994.
Okay.
So I was called to open up the parent craft department and lactation department in Mount Alvernia in 1994, and in 2010 we actually launched our center, our lactation center in Mount Alvernia, and that's at the time that I launched my book on breastfeeding, the practical guide. And at that time I also produced video to help mothers in breastfeeding. Yeah.
So do you feel like there's been a whole change and more women are now
Oh
breastfeeding?
yes. It's a great change. You can see that now we have a lot of mothers coming into hospital, and I'm fully breastfeeding. I want to fully breastfeed. I want to breastfeed successfully. Yes, it's really a change, in the past 10-20 years.
Okay.
Yes.
And do you see a lot of women mixed feeding here in Singapore?
Getting less unless the mother is not aware of how to go about breastfeeding, or they have not find out more about breastfeeding, then they may advised by family member who not know much about breastfeeding, say, it may not be enough for the baby. But those who have attended talks or talked to lactation consultant before, or attending any forum or talked to mother with successful experience before, they will probably want to breastfeed successfully this time and without giving formula, especially in the initial period.
So we're going to go into the basics of breastfeeding here. So a lot of pregnant women, they worry about the whole breastfeeding journey, right? We worry that we don't have enough boobs, like our boobs are small, so what's going to happen? And so does it matter how big your breasts are?
No, the size of the breast doesn't really contribute to the amount of the milk that you're going to produce, but it's important that the milk glands is there, and then that where it make milk, you see, that not the size of the breast. It doesn't really contribute the quality and quantity of milk.
Okay.
Yeah.
And is there any type of nipple shapes that just make the breastfeeding journey easier?
Yeah, of course, if it's a normal nipple, then it's easier for baby to latch on. But in fact, flat nipple, short nipple, mother can breastfeed as well, but as long as they know how to support the baby well and support the breast well and shape the breast well, they can get the baby to latch on as well. But there are some recommendation that preparation can be done antenatally as well.
Okay.
Yeah.
And what about in the pregnancy journey itself? Can a mom start preparing herself for a successful breastfeeding journey?
I think it's important to do that, you see, because if they have, they are more well prepared, at the same time have some knowledge, sufficient knowledge on breastfeeding, and then they know how to start off right, it will be very smooth and easier for them.
Okay. Is there something that they can do? So besides the knowledge, can they eat? Can I drink, papaya soup when I'm pregnant and then
I think it's
confirm
not
that I have?
necessary. It's not necessary at that time, but I think you can eat well balanced diet, so that you will be able to prepare to produce good quality of milk for the baby. Because diet does affect the quality of the milk. Yeah. So after delivery, I think it's important that you eat well balanced diet as well and feed the baby often. And most mothers will produce more than enough milk for her baby.
Okay,
Yeah.
so there's been a whole new trend recently that the moment you deliver your baby, you're immediately supposed to start latching your baby before you clean your baby or anything. Is that a good practice?
Yeah, well, you don't have to force the baby onto the breast straight away after birth. So I think the recommendation now is to have babies skin to skin with you immediately after birth, preferably in the first 5 minutes for an hour or so. So maybe after 30 minutes or so, the baby may show readiness to feed. you can actually latch the baby on. And surprisingly, a lot of baby actually can self-latch at that time.
Yeah, I've seen the video of the
Yes.
breast crawl.
Yeah.
Is that really true?
Yes, if the mother is not really heavily sedated, the baby will be quite alert and awake. And then you observe the baby on the chest, you will find that the baby will go through the 9 behaviors. That look at the mother, touch you, and then sometimes squeezing the nipple, and then get ready themselves to latch on. So you'll be surprised to see that baby can self-latch at that time.
That's fabulous.
Yeah.
Would you say that first latch is the most important?
Yes. You see, once the baby can latch well, the mother actually have more confidence to breastfeed the baby after that. Yeah.
Okay. Moving on to colostrum. What exactly is colostrum, and why does everyone talk about it?
Yeah, colostrum is an essential food for baby in the first few days, and it's already started secreting during pregnancy. Around 16 to 18 weeks of the pregnancy, the mother started to produce milk. But at that time, the milk may not flow, easily. It's because of the pregnancy hormone that to keep the pregnancy going well. So the milk may not flow very well. But once the baby is born, the breast is ready to release this milk for the baby. So of course, if the baby is suckling earlier, the colostrum will flow earlier because it's very thick and sticky. It comes in only teaspoon form.
So in a day, how much colostrum will we produce?
Yeah, it's in the first few days probably 15 to 30 mils.
Oh, that's it.
Yes,
okay.
at that time. Yeah, it's not that much. It comes in teaspoon form. Each feed maybe may take 1 or 2 teaspoons. So if you feed 8 to 10 times, the baby actually get this very thick, very sticky type of fluid that contain a lot of protein, a lot of immunoglobulin, a lot of antibodies, vitamins, minerals. It's so rich that come in a concentrated form. And that is sufficient for the baby. It's enough for the baby's requirement in the first few days. Then the transition milk will come in on the 3rd, 4th day.
Okay.
Yeah.
So a lot of babies are born with jaundice or have jaundice in the first few days of life.
They should not be born with jaundice.
Okay.
But after first few days, they may show yellowness on the skin. It's due to the breakdown of the red blood cells. At the same time, the baby's liver is not mature enough to secrete it. Yeah, that's why it's important for the mother to feed the baby well, so that the calorie milk can bind with the bilirubin in the gut that can pass out in the feces. So that will be better.
But a lot of jaundice babies are excessively sleepy and they may not want to latch.
Yeah,
so then what happens in those
quite true.
situations?
That's why we want the mother to start breastfeeding early in the delivery suite. After that, they can room in the baby and start breastfeeding frequently, so the baby will not develop jaundice that badly, or that high jaundice or too soon. So that even that the baby is jaundice, the mother need to feed the baby more often. Then sometimes we encourage them to wake the baby up to feed. Yeah, you have to wake the baby up.
And do you wake the baby up gently, or is there?
Yeah, it can be gently, because you talk to baby respond to voice and touch. So you talk to the baby, touch the baby, or gentle massage on the baby chest, hand, feet. The baby will wake up.
Okay.
Yeah. Then we will gently burp the baby. It's to wake baby up, not expecting baby to burp, but that will help the baby to wake up further.
So a lot of women also start using breast pumps very early on. So when's the ideal time to move towards using a breast pump?
Yeah, usually we don't encourage mother to start on pumping the breast too soon. Is because if it's well baby and the mother is, the baby is with the mother most of the time, then they should be latching the baby, unless separation taken place. They say the baby is in the special care, or the baby admitted for phototherapy. There's separation, or mother going to work early, then they may need to pump. But generally, most mother would like to latch the baby frequently to build up the milk supply, to establish the milk supply, especially in the first few weeks. If you have to use the pump and latching the baby at the same time, you'll find that you're very tired. Yeah, so that's why we encourage mother to latch the baby as often as the baby wants, according to the baby cues on the. So then they can try to get some rest in between feeding time, and it's not necessary to pump, because pumping at that stage may not be as effective as the baby suckling. Yeah, because baby suckle can get more milk, because at this early few days, you will find that the milk is so thick and sticky, it may not flow into the bottle. So let the baby receive it directly from the breast will be better.
Okay.
So
and from
maybe,
Sure.
maybe a few weeks later, 5,
Okay.
6 weeks later, they can start pumping. It's because they will probably like to introduce 1 bottle of the breast milk a day for the baby. And that's how they train the babies, try to wean slowly on the bottle, but not too many bottles a day, 1 a day, maybe 2 weeks later they will add on another bottle. So by the time mommy go to work, the baby can take both ways of feeding.
Okay. I think a lot of moms have concerns in terms of supply issues. Are there foods they can eat, or is there any rules or tricks that you can share with us on how to increase supply?
Actually, the priority is to get baby to latch. Latching will help the mother to increase the milk supply and started the milk coming in early. And then of course psychologically, if you find that any food can help you, you can take. Now in the in market, a lot of mothers find that fenugreek help them a lot, or malangui is a green vegetable, and oats. Just the simple food, it can help them. And then of course, not food doesn't work alone. Even medication doesn't work alone. Stimulating the breast is still important.
Okay. So how do you stimulate breast milk supply? Is there any type of massage we can do, or?
In the beginning, we actually teach mother gentle massage before feeding,
Okay.
and then ensure the baby's latching well.
Okay.
Because the most crucial part in breastfeeding is to get the latch right. Once the latch is good, the baby will receive more milk, and in turn the mother will make more milk, and it will also affect the letdown reflex to work better.
Okay, so 2 follow-up questions on that. Does stress contribute to low breast milk supply?
Generally, yes.
Okay.
It does. It's because it may affect the letdown reflex, and in turn it will affect the milk supply.
Okay.
When the mother is very stressed, very tired, in pain, it may affect the letdown reflex at the time.
What about amount of liquids that we drink, like water and soups?
Well, you have to drink enough to quench thirst. You don't have to drink liters and liters of water or fluids. Drink enough to quench thirst will be good.
But in the confinement practice, most of the time we're told to avoid water and just drink red date tea or drink more soups. Is that still advisable?
Yeah, it's okay. Because what they mean is that they drink water. Why you don't want to drink water? Because drink water is plain, nothing. But then if you drink longkang water, red dates water, there's some nutrients in it. So it's okay if you think that water is okay for me. It's alright. If you think that red dates water in the tradition is also okay. Or soup, whatever drinks that you prefer, it's okay. Yeah.
And are there any things like milk killers? Like I've heard that cabbage is a milk killer. Is that true?
Not to all mothers. For myself, I like cabbage. But I
Okay.
have plenty of milk. Some others say, if I take broccoli, I seems to have less milk. So it's very individual. Yeah.
Okay, so there's no like golden rule
No.
or golden food to avoid or have more of?
No, of course, if you eat more dark green vegetable, you seems to have more milk.
Okay. What about durian?
Durian you can take, but no need to take excessive. But a lot of people thought that, will the milk smell durian? But in actual fact, no. Yeah. But it's high protein though.
So for some women the milk is very thin, and for some women the milk is slightly thicker. Is it? How do you thicken milk? Is it important to have thick milk, or is thin milk okay?
You see, milk come in 2 forms, especially mature milk. Now, in the beginning, the mother will probably see the form milk that is very clear, very light, and this is what we call form milk that contain a lot of water, a lot of lactose. As the baby suckle on the same side, the baby will receive the high milk. They come later, especially with the letdown. This milk is actually whiter in color. We call it high milk that contain more fat, more calorie, more nutrients. So more antibodies as well, and therefore we look whiter. So that is the main difference.
Okay.
Between the form milk and the high milk. Yeah.
So is there a way that I can have more hind milk?
Yes, you can. They say if you feed the baby long enough on one side, the baby will receive high milk.
And how long should a feeding process? How many minutes should I feed?
Yeah, usually we will not specify how long the baby should be on the breast. We usually will tell the mother that in actual fact there's no time restriction on the breast, how long the baby should be on the breast. We will allow the baby to suckle as long as the baby wants until the baby is satisfied. But averaging baby may take around about 20 minutes.
20 minutes, okay. So we've got, is it true that eating spicy food can affect breast milk taste?
Generally not. There's no scientific record on that, and our Indian mothers Malay mothers, actually they go back to this normal food, spicy food straight away after birth. And
Okay.
their babies also fine with breastfeeding. And for Chinese tradition, a lot of them actually take the very rich in ginger food, especially trotter with the
Mhm.
vinegar, the black vinegar, and they put in about 1 kilo of ginger actually.
Oh wow.
So you will probably think that the milk will probably be very hot then, by then. In actual fact, in the first few days, we want the mother, especially in the first 2 weeks, we want the mother to take everything in moderation.
Mhm.
Yeah, because the baby liver is not mature enough to secrete anything that is too much for the liver to work.
Okay.
Yeah.
How do you relax during breastfeeding and combat breastfeeding boredom?
Actually, when you're breastfeeding, you should not be bored.
It's quite boring. I'm a nursing mom, and half of the time I'm like, oh, okay, how many more minutes?
Yeah. Think of that, when you're breastfeeding, you're actually relaxing with the baby. It's actually a special nurturing time with the baby, and that is how you build the bond with the baby.
That's the ideal world.
Yeah, ideal world. So that talk to your baby. Baby can communicate with you. Baby look at you with eye contact, smile to you.
But then
And
that could also be distracting the baby, and then he or she will lose the latch.
Yeah, in actual fact, bigger baby may not, but the newborn, sometimes when you talk to them, it's a soothing voice that comfort the baby. So in actual fact, the baby skin to skin with you, you feel the love for the baby, the comfort for the baby, the securities of the baby. So I don't know. Personally, I find I enjoy, breastfeed. Sometimes when my baby is not time for feeding, I say, hey, quickly wake up for feeding, So
Well, moms, if you're bored during breastfeeding, you just tune into the ParentTown app and you watch Sister Kang's episodes, right? Okay, how should a new mom combat negative remarks made from the elders during the early days of breastfeeding when the milk supply has not kicked in?
Yeah, in the first few weeks, it's very important that while the mother is establishing breastfeeding, and she need to feed the baby on demand according to the baby cues. But of course, family member can't see through the breast to see how much milk the baby consumes. They would like the mother to pump out the milk to measure how much. So from our observation, pumping will get much less milk than the mother can breastfeed the baby directly.
Okay.
Yeah. But before delivery, I think it's important to educate the family member, people around you, like mothers, mother-in-law, or confinement nanny, about how you're going to go about feeding your baby. So that, of course, they do concern about how much baby take, but it is very important for them to observe how much baby passing out. Yeah,
So
if there's some
calculate the
intake,
diapers.
the diaper, whether the baby wet the diaper frequently. Yeah.
Okay.
So day by day it will increase. By 1 week old, the baby should pass urine 6 to 8 times. The urine should be clear to tell you that, Mom, I'm getting enough, I'm well hydrated, and the feces will change color by 4th day.
Okay, so it'll change from dark color to
Dark blackish color to maybe greenish yellow color or slight brownish color.
Okay. If you have a bad mood, will that affect the mood of your child, or affect them during breastfeeding?
Obviously, yes. Because when you're bad mood, you're very stressed, it affect the letdown reflex, and then you will affect the milk flow, and the baby sometimes complaining of like, I don't get much of the milk, I don't receive enough milk. Yeah, the baby will probably become more fretful and then more demanding, and then want to feed more often and even longer feeds. So that's quite not common.
Okay. Now, with regards to storing of breast milk, so moms who have expressed their milk and they go back to work and they store it in the common fridge, is that okay?
Yes, it's okay because in room temperature we only allow them to store it for 4 hours in the fridge itself. That means lower compartment, meaning that chiller area, it can be stored for 2 days.
Okay.
If it's in the freezer, it can store up to 3 months.
But do you need a separate breastfeeding fridge, or can it be with?
Not necessarily. As long you store it in an airtight container or bottle
or Ziploc bag.
Yeah, milk bag. If you're still worried that I have a lot of other food in the fridge, you can actually Ziploc them together and then put it just separate in the separate bag.
And when a mom is expressing, so by the time she finishes expressing one side and she starts on the next side, what does she do with the waiting bottle? Does she go and put that in the fridge and then start on the second side, or is it okay for the milk to be out for 20 minutes?
It's okay. It's okay, yeah,
Okay.
yeah. Because you know why, when you do the pumping, but a lot of mother now use double pump. They can actually pump both sides simultaneously to receive the milk, at the same time.
Okay.
Yeah, but then 10-15 minutes difference should not make the milk spoiled or anything.
And is it okay to mix? So for example, I do one session right now and I do another session in 3 hours. Can I mix my new session with my old session's milk and then?
Yeah, it depending where you put the milk. If it's in the fridge, it's okay. So you can straight away pour in, but you have to refer to the first timing. They say, the first one was 2 o'clock, but now 5 o'clock, you pump another lot, you put into the 2 o'clock milk, you have to consider this is 2 o'clock.
Okay.
But then we will not recommend to, mix with the frozen milk. It's because you may melt the frozen milk. So it will be good to chill this frozen milk first. When it's cold, then you add on to the frozen milk. Then we call it layering. So you also refer to the first timing.
Okay. Now we're just going to do 2 more questions on trying to stop breastfeeding. So generally, WHO recommends that you stop. You can start mixed feeding or starting solids from about 6 months.
Yes.
Now, for women who choose to stop breastfeeding altogether at the 6 months mark, how do they stop? How do you just suddenly stop?
Yeah, you see, stopping breastfeeding is depending on your supply as well. So gradual weaning will be easier for the mother and less painful and less problem for the baby as well. So they may stretch the feeding time or pumping time, or cut down 1 feed a day. So you do gradual weaning will be better than abrupt weaning, so that you don't have a crying baby that looking for the breast to suckle and then demand for the breast milk. So you will do it gradual, reducing 1 feed a day. Then it may take you 1-2 weeks to stop.
Okay. And the last question is on blocked ducts. What do you do with blocked ducts? So especially when you're ending the whole breastfeeding journey.
Yeah, correct. Yeah, actually, blocked duct is very painful. So when there is any blocked duct, we actually encourage mother to do gentle massage, but they must know the technique. So I usually would teach them to support one side of the breast and then put the hand on the affected area, push inwards towards your chest.
Okay.
Yeah, then you massage. And then after that, you drain it towards the nipple area, get baby to feed, or you can start pumping.
And what kind of pressure should you be using?
Moderate pressure.
And
so
do you use your thumbs or do you use?
I will prefer them. You want me to demonstrate?
Yes, absolutely.
Yes, yeah, okay, yeah. So I will, usually, let's say this part is blocked. Then she'll find that it's very painful, this area. So I will probably ask her to support one side and then push on this area, the affected side towards the chest and massage circular.
So massage is circular.
Yeah, circular. Put the hand flat. Don't put the fingertips. Okay. If you put this way, also not that effective. So the effective way is to put all these 3 fingers flat onto the breast, push inwards towards your chest and massage. After that, just stroke it towards the nipple area.
And how can you feel the ducts? Is it because it's
lumpy?
lumpy?
The mother can feel that this is the painful part, and then after you drain it, you will find that this area gets softer.
Okay.
Yeah, then gradually you do it, number of times. You need to do it, for probably 15-20 minutes like that. But don't bruise the breast. Most importantly, if you just apply a little pressure towards your chest and massage, it will not. Then sometimes we will do the up down effect like that to loosen the duct.
And so do you do this in the shower or do you do this?
No, usually if the mother have blocked that, I will teach them and then to do it like before pumping or before feeding the baby.
But sometimes they say that in the shower it just makes it easier.
You can also do, yes, you can also
the breast feels softer.
Yeah, some mother find that it's very effective because with the warm shower, then they will probably push in and then massage and then just drain it, and then sometimes it will actually help to release the block.
And some moms also use the old teething comb. Is that advisable?
Well, I have seen many have done that, but not much of the effect.
Okay.
Yeah,
so your fingers are just good enough.
Yeah, fingers is the best way. Palm also doesn't really help that much. So most of the time, if we want to do one-to-one, we will probably spend about 20 minutes to massage for them. If the mother need to feed the baby or pump, they don't have to massage that long. So what they do is they massage for a few minutes and they can latch the baby. It will be very effective.
Thank you, Sister Kang, for joining us here today. Do you have any last words or passing advice for our moms on their breastfeeding journey?
Yes, I think all new moms it will be well informed about breastfeeding, how to go about breastfeeding, how to start off right is important. So try to attend public talk on breastfeeding or antenatal classes to have hands-on practice so that you're more confident in breastfeeding and know how to start off right in breastfeeding. And soon after birth, start your breastfeeding early and ensure that the baby is latching well. Talk to a lactation consultant if you have any doubtful questions before you deliver, or after delivery, work with the lactation consultant to ensure that the baby is latching well before leaving the hospital. Or if you encounter problem at home, then seek help from the professional body, like lactation consultant or nurses in the hospital, or any resources that breastfeeding mom that can help you. That would be wonderful.
Thank you so much again, Sister Kang.
Yeah.
And for everyone tuning in, thank you for watching ParentTown TV.